Right now at 5, we're following a new warning from the CDC about a new strain of a highly infectious stomach bug. It's resistant to medicine that doctors would normally prescribe. Abby Larico with our Verify team has what you need to know tonight.
We're talking about Shigella. Now, hearing about a new, highly infectious anything can be scary. So we turn to the CDC and pediatrician Dr. Madeline Gagnon to verify what you really need to know to stay safe. First, what is Shigella? It's a bacteria spread very easily through fecal matter, even just tiny traces of it, that causes shigellosis. It can be mild or severe. Symptoms include diarrhea that can last several days, fever, stomach pain, and an incessant feeling like you need to go even when you don't. So why are we talking about this? Because the CDC just issued a new report warning the version of Shigella spreading right now is more drug resistant.
The infections that are rising are of a variant of Shigella that is harder to treat.
There are about 450,000 Shigella infections in Americans each year, but the CDC data shows the percentage of cases from these drug-resistant strains went from 0% in 2015 to 5% in 2022. Now, this can impact anyone at any age. The CDC says historically, shigellosis infections have been associated with young kids, but more recently, the increase in the antibiotic-resistant infections is observed in adults, including especially men who have sex with men, people experiencing homelessness, people living with HIV, and international travelers. Right now, the CDC doesn't really have a recommended alternative for antibiotics they'd normally rely on. The good news is that the infection often goes away on its own, but the best way to stay healthy is avoid getting it in the first place. That means practicing safe sex, refraining from intimacy, going to work or school, or preparing food when you're exhibiting any symptoms. And it's always a good idea to thoroughly wash your hands, especially before eating or touching your face. With your Verify, I'm Abby Larico.
No matter the question, our Verify team is dedicated to getting you answers. If you see a claim online that you want us to verify, send us an email. You can also text the word verify to the number you see right there on your screen.